Hello there and welcome to the Outside Views weekly report on Welsh politics. A new £5 million innovation fund is to be established to support further education colleges and look at new ways to support learners. That's what the Minister for Education and Welsh Language, Jeremy Miles, has announced. The fund will invest in projects which aim to support learners in key areas, including skill development, well-being and resilience, and adaptability, while helping FE colleges work together. Supporting creative solutions is at the heart of the fund, encouraging colleges to explore new ways of working and continuing to ensure Wales is a place where people of all ages receive a high-quality education. Colleges have already implemented successful initiatives like junior apprenticeships, employment bureaus, and accelerated learning programs. The fund will look to expand on these already successful programs. Alongside this, the Minister has also allocated further funding to FE colleges to help with rising cost. Over £2.5 million will be used to support learners undertaking vocational programs by helping colleges to cover the increased cost of consumable materials like wood and steel, critical to vocational courses such as construction. The Financial Contingency Fund will also receive a boost of £1.345 million. The fund supports learners who are experiencing financial hardship, enabling them to continue to access a college education. Learners who might be entitled to this support should get in contact with their college. Major new plans to make Wales a global centre of excellence and the leading location for medical radioisotope production in the UK, which would help address a fast approaching supply crisis for nuclear medicine around the world, have been unveiled last week by the Welsh government. In the UK, across Europe and further afield, the equipment in facilities currently producing life-saving radioactive substances known as medical radioisotopes, which are critical to cancer diagnosis and treatment, are coming to the end of their productive life and being closed. As a result, by 2030, the UK faces a reality of having no medical radioisotopes or the ethical nightmare of having to ration them. The consequences of supply interruptions are significant. The temporary loss of isotopes from the cyclotron at Cardiff University's PET Imaging Centre impacted diagnostic scans for several diseases, especially cancers. A more general loss of supply would have a significant detrimental impact on patient outcomes and survival. In response, the Welsh Government has developed plans to secure the supply of medical radioisotopes for Wales and the UK through the development of Project Arthur, that stands for Advanced Radioisotope Technology for Health Utility Reactor. Based in northwest Wales, the Project Arthur facility will be a public sector national laboratory with its own nuclear reactor. It would produce medical radioisotopes and supply them to NHS Wales and the other national health services in England, Scotland and Northern Ireland. Project Arthur will be a major Welsh and UK strategic initiative and is a multi-decade endeavour, a commitment of some 60 to 70 years. Once up and running, it will then be one of a few facilities in the world focusing primarily on medical radionuclide production. As well as providing vital services for the NHS across the UK, it will also help stimulate the North Wales economy by attracting highly skilled jobs and industry, creating a surrounding infrastructure, build local supply chains, and support local communities. The jobs created, both direct and in the associated supply chain, will be long-term and sustainable for people of different socioeconomic backgrounds and skill sets. They will include roles such as research scientists and engineers, drivers, operations, production, technical and office staff. The facility would also help sustain and build strong, cohesive and long-lasting communities. This will be especially important in those rural and Welsh-speaking communities across North Wales, which have been heavily reliant on jobs in the nuclear power industry. The project is a major collaborative development between the Welsh Government's Department of Health and Social Services and the Department of Economy. The potential developments resulting from the new medical school in Bangor, aligned with Project Arthur and other health technologies, presents the best regional solution to a sustainable and secure radiodiagnostic and radiomedicines capability in North Wales. A new pilot program to support schools in tackling the impact poverty has on attainment has been launched. 7 head teachers from across Wales have been recruited as attainment champions. The team brings together head teachers from across Wales who have a wealth of experience and have already helped shape key national policies and overseen community-inspired projects. The pilot will run for 6 months with the role of the attainment champion, providing peer-to-peer support to schools and to help inform Welsh Government policy around educational attainment, drawing on their own experience and sharing best practice. The National Academy for Educational Leadership are supporting Welsh Government and has helped recruit the new attainment championships. The number of additional dental appointments provided this year has reached 109,000 according to the latest Welsh Government data. Welsh Government changes to NHS dentistry contracts offered to practices since last April include a requirement for NHS practices to see new patients. The Welsh Government expects an estimated 112,000 new NHS patient appointments will be possible this financial year. However, the Chief Dental Officer for Wales has warned that missed appointments are impacting on people who need dental treatment the most. Andrew Dickinson has asked patients to avoid missing appointments where possible or notify their practice in advance when they are unable to attend. According to the NHS Business Services Authority, 9.4% of all NHS scheduled appointments last year were lost due to patient non-attendance, the equivalent of 3.5 hours of clinical time each week for every practice. Welsh Government ministers have last week visited credit unions across Wales as they announced continuing funding of just over £422,000 a year for the organisations which offer vital support to those struggling with their finances. Credit unions are non-for-profit and owned by the people who use their services rather than by external shareholders or investors. Actively involved in communities throughout Wales, credit unions contribute to the economy and the financial well-being of members who can save safely and borrow at an affordable rate of interest. Credit unions can help those who might traditionally find it difficult to save through offering schemes such as payroll deductions. They also offer Christmas saving schemes that only allow withdrawals in the lead up to the festive season, which helps at an often difficult time of the year. The Welsh Government provides credit unions with revenue funding to ensure they can develop a host of projects in communities aimed at boosting membership. In a clear demonstration of the importance of credit unions in Wales, ministers within the Welsh Government and the Cabinet took part in a coordinated visit across the length and breadth of the country, raising awareness of the service they provide, which includes ethical and affordable lending. And this concludes this week's report on Welsh politics. And as I said many times before, I know not many people will watch this, but I think it's important to talk about the devolved politics as well. And so I will continue doing this. I'll still see you in my next video. I'll be back.